When you're pregnant, you don't expect to have any complications, but we truly believe that we had a miracle.
We were very blessed to have a number of doctors to fight for this baby.
The sacrifices that we had to make, the juggling that we had to do, the shuffling of cars and people driving me from one facility to see the kids.
In our experience, I think it would have been really nice if everything would have been in one building.
One facility to connect all the doctors and all the nurses.
In such a special situation of a baby needing help before the baby was born and after the baby was born.
For a mom to give birth to her child in the same facility where she can be cared for.
It's very powerful to have it in one place.
A whole mecca of minds there at your disposal.
It's a luxury that every woman deserves and that every child deserves.
Houston deserved to have a world-class OB-GYN department and service, and we knew that we could build that. This pavilion for women.
An entire, almost million-square-foot facility dedicated to obstetrics and gynecology and fetal intervention, with all of the subspecialties that we need and all of the support under one roof.
It's been the passion and the vision of Texas Children's to improve neonatal outcomes and improve the health of children. To be able to accomplish that goal, we should back up and begin taking care of mothers, and that's why this facility is so special. It provides the complete continuum of care.
Every mom is going to want to have her baby in the pavilion, whether it's going to be a high-risk delivery or not, because she will know that all of the services of Texas Children's Hospital are going to be immediately available. A one-of-a-kind fetal center bringing together fetal intervention, fetal surgery, maternal fetal medicine, fetal cardiology, genetics, ultrasound, neonatology, nutritionists, pediatric subspecialists. It's going to be remarkable.
I don't think that there's another place like this in the world, and it's going to provide a great platform for all of the specialists to get together and to work together as a team with the one focus dedicated to the mother and the fetus, the maternal fetal unit.
We have private NICU rooms. I mean, babies are very tiny. These rooms are huge, right? Because it's the right thing to do to care for the babies, is to have their families close to them.
You actually diminish the environmental stimulation that's deleterious to one that's the family. And there's no better, more optimal situation than having even a really sick baby in the same room with their family.
It's a state-of-the-art facility, but at the end of the day, if you don't have the people and the programs and the processes inside, it's just a state-of-the-art facility.
We had a national search looking for a full-time OB-GYN-in-chief, and that's when we found Dr. Michael Belfort.
His passion for research and education is equally as great as his passion for clinical care, so it was worth looking across the country and all the interviews and time. He's our guy.
The people at Texas Children's Hospital and the organization combined with Baylor College of Medicine, that is an unbeatable combination. And that's really what brought me here, the potential to really raise the bar for obstetrics and gynecology. Within high-risk pregnancy, we're able to deal with any medical condition where pregnancy could pose a risk. And we'll have fetal intervention, and that is in utero procedures on the fetus. All of these problems we can help our patients with.
Both maternal fetal medicine, fetal intervention surgery are at the forefront of surgery today. And to have a close association with the Children's Hospital, I think, is absolutely critical, because the two have to work together for the successful outcome for the babies.
Everybody's aware of what's going on down here. I mean, what's going on here is unprecedented.
We are not here to do what everybody else does. We are here to move the field and do what nobody else has ever done.
We're going to save a lot of babies, and their lives are going to be enhanced like never before. And I think most people recognize that it's a once-in-a-lifetime opportunity.
No one has ever put together a comprehensive team of physicians and nurses and employees to take care of mothers and babies in one central location like we're doing here. No one else has ever done that anywhere in the country.
The struggle will never be over of having a child that has special needs. And that's where you just go back to being so grateful that there's a place like Texas Children's Hospital, because here's where it's happening. The greatest minds are right here in Houston. So why would you go anywhere else?